I'm about to show you an equation that used to make my skin crawl, but it's important to learn, especially if you work in a cardiac ICU. So up here, you're gonna see the equation for delivery of oxygen. When I first started learning it, I hated it. My name is Leah, I've been a CVICU nurse for 18 years, and today we're gonna talk about delivery of oxygen to the tissues in this hemodynamics series. Hemodynamics is how blood flows through the body, but let's talk about the whole point of that. The whole point of blood flowing through the body is to get to the tissues, to bring the oxygen to the tissues and take the carbon dioxide away. What are some things we could do to increase that concentration of arterial blood oxygen? If my patient is on a ventilator, I could just turn up their FiO2 if their oxygen is not very high whenever I check an ABG. If my patient's having a lung issue though, we start getting a ventilation issue, then we start having to get a little bit more creative with how we can give that patient more oxygen. If my patient's ABG is showing that their oxygen level is not great and they're not on a ventilator, then what can I do? How high can I go on the oxygen based on what's going on with this patient? They might be a COPD patient, so maybe I cannot just go put them on a venti mask, right? Maybe I cannot just bump up their nasal cannula to 5 liters. Maybe that wouldn't be safe for them. But I have to look at my patient and ask myself, how can I increase the amount of oxygen that the patient is taking in? Or is there anything that I can do to help with the ventilation? Is there any way that I could make it where at the lung, at the tissue level, at the alveoli level, that I can help with that exchange? And so that's a more complex conversation, but the idea needs to start to be in your head of how can I increase the patient's oxygen level so that I can get more oxygen to the tissues, because no matter how good the pump works, if there's not good oxygen, I won't be able to help this patient that much. And then we can start talking about cardiac output, right? And that will be what our next video is gonna be about. So continue to follow this series. We'll continue to talk through some of these ideas about hemodynamics in an ICU setting.